Colchicum autumnale. Theme and essence, please. I wanted to go to characteristics first, then theme and essence. It's a very good medicine, it's not a polycrest though, but it's very impressive and very useful as well. No other medicine has this kind of sensitiveness to the smell of food. Not even your arsenic, not even your phosphorus, not even your sepia.
Pregnant woman, you can give them this.
No other medicine has this kind of sensitiveness, especially to the smell of cooking fish.
Smell of cooking fish.
Fish, especially fish and fish. Fish is cooking and it's nausea and he's going to faint, and that kind of sensitiveness to the smell. Especially fish. They can be eggs and meat as well, but especially fish. If you go to characteristics, point number 1, please. It's the leading medicine for nausea, especially from the odor of cooking food, but I will say especially proteins and especially fish. Did you get that? Nausea, vomiting, even faintness. You see, patient is almost going to faint from the smell of food. Especially the smell of cooking eggs, fish and meat. It's extremely nauseating. It nauseates them even to the point they're going to faint. That kind of nausea you'll get with colchicum. It's a topmost medicine. You see in brackets I've mentioned arsenic cannot bear it. Sepia too has nausea. But this kind of acute, nausea, acute fainting, almost to that point, colchicum has that. That's the topmost medicine. You're with me? Wonderful for morning sickness, especially in pregnant women who tell you, they have total loss of appetite because they tell you whenever they see eggs, even seeing the food, they get that nausea. They see eggs or somebody's frying eggs in the kitchen, somebody's frying fish in the kitchen, they're going to jump out of the window. That kind of sensitiveness to especially proteins. I've mentioned you see eggs, fish and meat. So all kind of animal proteins, you can get an aggravation. Remember the 3 things: nausea, vomiting, faintness. That's the topmost indication for your colchicum. You're with me? Now, second interesting thing, which is a story which I'd like to share with you for colchicum. Story. A young man in his 30s, alright, in UK, and he saw somebody crossing the street. An old woman was crossing the street. He was waiting for his bus and he sees this old woman crossing the street. And this old woman was trying to cross the street when it was green, right? So there was no cars, but she was trying to cross the street when it was green light. And one car came and just suddenly gave the brake and stopped. And this man came out of the car and started hurling, like inexplicable abuses at this old woman. Why are you crossing the street? It's still green light. You don't know what to do. That kind of, she was abusing and abusing and abusing. You with me? Yeah. And this man who was standing in the bus stand waiting for the bus, he saw this old lady being abused, and this lady didn't say anything. And he felt really bad, right? But he wanted to go and tell something, but that man went into his car and was gone in a whoosh. So he saw this old lady insulted and he felt really bad about it, right? That she shouldn't be abused like that. She's a 70+ lady and abused like that just for crossing the street. You with me?
Yeah.
And he felt really bad about it, and this continued for a few days. He couldn't forget that incident, that how she was insulted like that. And a few weeks or a month later, he started developing IBS. IBS-like symptoms, dysentery or mucousy stool, these kind of symptoms. So what's the cause? You see, a cause on one hand, reaction on the other hand. He was absolutely fine before that, so he could relate that it started after it. He saw somebody being insulted or humiliated, not himself. Yeah. So you can't say that ailments from humiliation or ailments from insult, right? You're with me?
Yes.
And on the other hand, the reaction is a dysentery or a mucousy stool or IBS-like symptoms. You agree with me?
Yes.
Now have a look in Allen's for colchicum. There's a very interesting line in Allen's for colchicum. Ailments from grief or misdeed of others. So somebody did a bad deed which shouldn't have done, and you saw that and you got affected by that. Did you get that?
Yes. Okay.
You saw somebody being insulted, somebody being humiliated. So it's a misdeed which somebody did. Not to you. You see, that's the thing in colchicum. Not to you. You understand what I mean?
Yeah.
And as a consequence of that, you're developing this kind of IBS-like symptoms. Many patients, if you get patients with IBS, they will tell you there is some emotional triggering factor sometimes which causes this IBS to develop.
Yeah.
You understand what I mean?
Yeah.
There's always an emotional component with IBS. Could be anxiety, like what we get in arginate. Could be this aspect of seeing someone being grieved or seeing someone being insulted or humiliated, which could have resulted in these symptoms. And you see in bracket it's mentioned staph aureus.
Yes.
Right? So often what can happen, you can start the case with colchicum, you can follow it up with staph aureus. You know staph aureus is one of the leading medicines for ailments from injustice.
Yes.
Right?
That's right. I was thinking.
Bad effects from injustice or causation from injustice. So colchicum you can start with, you can follow it up with staph aureus as a deep acting follow-up. But colchicum also has that, do remember this. So you see someone being humiliated, see someone being abused, you couldn't do anything about it. So the person committed a misdeed, you saw that, you couldn't do. Like a woman was molested on the street, a woman was exploited on the street, and you saw that, you couldn't do anything. So you're seeing that, but you can't revolt against it. So that's an injustice, but the misdeed of others. You can start with colchicum if you have predominantly gastric manifestation. That's the thing for colchicum. Colchicum is more gastric. Right? So IBS-like symptoms will develop. You understand what I mean?
Yes.
But you understand when you follow it up with staph aureus is more like a polycrest. So it will cover many areas as a consequence of that injustice. You understand what I mean?
Can it be COLCHICUM?
Can be causticum staph aureus, but causticum generally revolts against it, because causticum is affected by injustice and he will go and fight for it.
But have no time for revolt because he.
Yeah, that's the thing that can be as well. But if you think of seeing or doing injustice and couldn't say against it or didn't have the chance as well, that's more like staph aureus, because that's getting inward, isn't it? That's getting suppressed.
Yeah.
He couldn't express that. So that takes you more towards staph.
Is injustice
Injustice. Yeah. More, yeah. You can say injustice in acute, resulting in gastric symptoms. That's more like colchicum. Acute injustice, affected by injustice, and resulting in more gastric reactions. That's a good indication for colchicum.